Hello, everyone. Good morning, good afternoon, good evening, wherever you are in the world today. My name is Nekme Obasoge. We are broadcasting live from Toronto, Canada. Guess what? Today we have a guest with us in the studio, all the way from California, Dr. Sota Omoigui. Dr. Sota, you are welcome to Nebo TV today, sir.
Thank you.
Before we will dive into the main topic of today, I would like to introduce Dr. Sota to our audience by reading his biography. Dr. Sota Omoigui, MD, is a medical director of the LA Pain Clinic in California. He is a board certified in anesthesia with subspecialty certification in pain medicine. He has served as an advisor to the United States FDA Advisory Committee on Anesthetics and Life Support Devices, recipients of the US FDA Advisory Committee Service Award in recognition of a distinguished service to the people of the United States of America. On July 4th, 2024, he described the first home intervention to prevent and treat sickle cell crisis in 100 years. Let oxygen be your medicine. Oh my goodness. You are welcome to this program, Dr. Sota.
Thank you, Ms. Obasogi.
Yeah, for all this discovery, what you have done to shape the treatment of sickle cell in the United States, we have a video that we are going to play for the audience. If you have anything to say before we play the video, sir, go ahead.
Um, Thank you very much. What this discovery entails will be a paradigm shift in the management of sickle cell disease all over the world. It's a movement from a reactive paradigm that has been going on for the last 100 years and actually from 7,300 years of human history to a proactive preventive paradigm whereby instead of waiting to treat the patient who is already having a crisis, we prevent the crisis right from home. So this will decrease crisis, decrease hospitalizations, decrease the stress to the patients, the pain, the suffering, and decrease the stress to the families, decrease all the complications. It should be a major change in their lives. Diabetes was a death sentence until 1921 when Banting and Best discovered insulin. And after that, it became a manageable disease. So the goal here for this discovery is to make sickle cell a manageable disease where hospitalizations and crises are few and far between.
Interesting. So we also have a testimony that we're going to play. But first of all, let's go for this first. Is it not playing?
That's okay. I can share my screen and play it.
No, no, don't worry. Should play. Let me make it solo. Let's see if you can play it. Now, Dr. Sota, do you have anything to add to the video we just played?
Um,
Before we play
yes,
the second one, that one is more or less a testimony, right?
yes. So essentially, the whole concept of this discovery happens upon the it's based upon the research that has been done in the last 100 years, starting from the description of sickle cell disease by Herrick, who saw sickle cells in the blood of a dental patient in 1910, to Hannah Gillespie in 1927, who correlated the phenomenon of sickle cells sickling to hypoxia, which hypoxia means a low oxygen environment. And then the most critical discovery was in 1930 by Scriver and Waugh in Canada, who stated that the sickled hemoglobin sickles in a low oxygen environment, but that is reversible if it is reoxygenated. So in the early phase of a sickle cell crisis, these cells can reverse back to normal if they see oxygen. And that's the exit ramp for a crisis. So what happens is that with repeated sickling, the cell membrane gets damaged. The reversible sickle cells progress to irreversible sickle cells. At that point, oxygen no longer works on them. So let me an example. It's like you have cars in traffic on the freeway, the highway,
Mm.
and the cars are running out of oil, so they park on the side of the freeway. So if you go and give them oil, they can get back on the freeway and drive. But once the oil runs out completely, the engine knocks. The car can no longer get on the freeway.
Mm.
The car has to be removed by a tow truck. So
Mm.
with sickle cell, once the reversible sickle cells progress to irreversible,
Good.
which is which is the point at which the patients are seen in the hospital,
Mm.
those irreversible cells are never going to recover. They are going to obstruct the blood vessels, create lack of blood flow to the organs, create severe pain, ischemia, damage to multiple organs, the bones, the lungs, the brain, that's a stroke, the kidneys. So multiple organs are now damaged, and the body has to remove these irreversible cells by destroying them, which is a process called hemolysis. Now, when the body destroys them, that's when the hemoglobin drops. The patient gets severe anemia
Mm.
and requires the blood transfusions or multiple blood transfusions.
Mm.
That has been the
Okay. So the blood transmission will stabilize the cells.
no, the blood transfusion is to replace the blood that had been destroyed, the irreversible sickle cells. That's why they need a blood transfusion. So that's the issue. The issue is that we've just had a reactive treatment paradigm to treating sickle cell, whereas it should be a preventive paradigm, in which case oxygen must be administered at home, in the patient's home, not waiting till the patient gets to the hospital. So that means the patient needs to have either an oxygen cylinder or an oxygen concentrator, administering with a nasal cannula 1.5 to 2 liters per minute of oxygen. At the moment they feel a crisis coming on.
Mm.
So when they feel unwell, they're in a high altitude,
Mm.
they've been exposed to cold. When they feel unwell for any reason, they should apply the oxygen. And that's why let oxygen be your medicine.
Medicine. Oh,
And let your medicine be oxygen.
now I understand the quote. Let oxygen be your medicine. So let's play the testimony from one of your patients, right?
Yes.
One of your patients. Hello, sir.
Yes, can you hear me?
Yes, sir.
Okay.
So
Yeah.
you were explaining in the video, so you can as well explain to us now. The oxygen, the benefits of this oxygen, how people can get the oxygen concentrator. Have you introduced this treatment method to your homeland in Nigeria? So is this oxygen concentrator affordable? So go ahead, sir.
Yes, actually, there's a WhatsApp sickle cell advancement forum that was set up in September
Hmm.
by Mr. Feko Okaro um, to share my research with people all over the world, and since then, several people on that forum who live in Nigeria have purchased oxygen cylinders. So oxygen can be provided by a concentrator or by a cylinder. A concentrator is a device that takes in air, absorbs nitrogen, and produces oxygen. The cheapest brands are about 350 US dollars. And but for those who cannot afford that, they can get oxygen cylinders from their medical supply stores. And there are most medical supply stores in most cities in all over Nigeria. A typical oxygen cylinder I know from one of those supply stores in Lagos is 150,000 naira. With all the accessories, they come to 190,000 naira. Now that's for the cylinder. For the refills, it's about 20,000 naira. And the refills may take place every 2 to 3 months. So for 20,000 naira every 2 to 3 months, it's almost like $1 a week. That's much, much cheaper than the cost of a hospitalization. In many hospitals in Nigeria, just to take a registration card is 75,000 naira. So by the time you count the cost of the pain, suffering, hospitalization, complications, multi-organ damage, oxygen is about the cheapest medication. It's cheaper than any other medication for a chronic disease. So that's really amazing that for such a disease that has ravaged Africa for 7,300 years, which is the recorded history of sickle cell in the world, to have an intervention that is so cheap and so affordable in the global south is actually amazing. So,
My next question, sir. How much have people embraced this method of treatment in the United States of America and all over the world?
well, it is a new discovery,
Hmm.
and your Nebo TV is one of those that are bringing this discovery to the world. And thank you for doing that, Mr. Basugi. Um, so, as more people hear about this, more people adopt it, both patients, physicians, families, caregivers. In the United States in 2016, $811.4 million was spent on the treatment of sickle cell and its complications. So the economic, if you drop that to 90%, if you have a 90% decrease in sickle cell crisis and complications, you can imagine the economic impact to patients, their families, to communities, to countries, and to the whole world. So what we're trying to do with this discovery is a paradigm shift in the whole management of sickle cell.
Um, Play, I think you have a slide to show.
Yes, I can
Wait,
show that
okay. Share it,
slide.
share it. Let's see.
Okay. All right. So hold on.
Okay. Oh no, this is not the right one.
Hold on. Yeah, I'm sharing my slide. Can you see my slide now?
No. Reshare again.
Okay. I'm going to share again now.
You are not sharing the main slide.
Yeah, I'm sharing
Okay,
this.
now, yes. Now we have it.
Okay.
Now we have it.
Okay, so I'm going to go through this slide. Some of this may be a little bit technical and some may be more easily understood by physicians, but I believe everybody will get the whole point.
Yeah, the problem. Okay, let me see again.
Yeah, so talking about sickle cell crisis prevention and treatment in the golden half hour.
Hold on, sir. We can't see it here. It's not coming clearly. It's not appearing well here.
You're
It's
not
blank.
seeing it.
It's totally blank.
It's totally blank.
Okay. Now, okay, it's better now.
And what are you seeing now?
I'm seeing some. I think some documents.
Yes, okay.
Not exactly the slide.
Okay, so let me open that slide.
Okay.
Do you see the slideshow now?
Yeah. Yes. Yes.
Okay.
Perfect. Just go ahead.
All right. So sickle cell crisis, prevention and treatment in the golden half hour. Sota Omoigui, MD. The first solution in 7,300 years. Let oxygen be your medicine. The sun has risen after 7,300 years of darkness. 100 years of research has shown that irreversible sickle cell formation is time dependent, and hemoglobin S sickling is reversible with reoxygenation within the first golden half hour, about 30 minutes. However, when time progresses, the cells become irreversibly sickled. And these are circulating blood cells that do not respond to oxygen. They retain a sickle shape. These are the cells that obstruct blood flow, causing severe pain and organ damage. Whereas the reversible sickle cells can go back to normal if oxygen is provided within the first 30 minutes. The history: 1910, sickle cell disease was first described by Herrick. In 1927, Hahn and Gillespie suggested that hypoxia, or a low oxygen environment, caused the sickling of red blood cells. In 1930, Scriver and Wow in Canada reported that the number of sickle cells in the blood may be varied by the change of the partial oxygen pressure, that this is a reversible reaction. And this is the whole key to this discovery, that it's reversible in the early aspect of the crisis. It's almost like an exit ramp on the road where instead of heading to a terrible destination, you can get off the road. And that is what it does. By providing oxygen, you can exit the road to a crisis. Again,
Okay, now it's better. Sometimes the document will go blank, totally blank. I don't know why.
okay. Again, just let me know whenever it's blank. Okay, the above studies. 1983, Frank and Chu stated that the oxygenated reversible sickle cells possess the ability to readopt their discoid shape upon reoxygenation.
Yeah, it's not showing again.
Okay, I'll just be reading it. In 1991, Hebel stated that the cell membrane gets destabilized with sickling, and the destabilization is reversible with reoxygenation. In 2015, Melanie Gonick from MIT produced a video about reversible sickle cells and reoxygenation. And they produced this video for studies on hydroxyurea and medications that provide oxygen at a molecular level. But the clinical application was right there. If you provide oxygen, you can reverse these cells at a critical time point. Once that time point is passed, it doesn't work again. Even in 1992, Zipotsky et al. Repeated the same thing, that if they studied in a clinical trial the effect of oxygen therapy on the number of irreversibly and reversibly sickled cells in patients with sickle cell anemia. And they found out that inhalation of 50% oxygen in patients who were not in crisis produced a significant fall in reversible sickle cells and a lesser fall in irreversible sickle cells. And inhalation of the oxygen in patients who were in crisis reduced the reversible sickle cells, but not the irreversible. And in the group of patients that received air, there was no significant change in either reversible or irreversibly sickle cells. So essentially, the summary is this: reversible sickle cells can become irreversible after repeated episodes of sickling.
So, very quickly, let me jump in here. The sickling is the crisis.
Yes.
All right.
The sickling is the crisis. And initially, the sickling is reversible. So if you miss the time point of reversibility, repeated sickling damages the cell membrane. Essentially, it's almost like the cells, the red blood cells, they are like a form of a living organism. And so when they are sickling, people with sickle cell have a mutation in their hemoglobin molecule that makes it very sensitive to low oxygen environments. So in a low oxygen environment, the cells are struggling. They are struggling to survive. But once oxygen is provided, it's like a breath of life. They recover, they go back to normal, and they begin to flow normally. But if the time period is missed and those cells die, which means they have their cell membranes damaged, they become irreversible, they get stuck in the blood vessels. They don't move, they block the blood flow. And that's when by the time patients get into the hospital, they're in protracted sickle cell crisis. And oxygen no longer works. So the patients have to get pain medications, and the pain medications have to be potent opioids, morphine, pethidine, even ketamine. But I strongly advise doctors in Nigeria not to use pentazocine or tramadol because they have no effect on the patients with sickle cell crisis. Well, in the hospitals, they need to get pain medications, antibiotics, blood transfusions. It becomes a whole mess once those irreversible sickle cells get stuck. And that has been the whole paradigm of treatment in the last 100 years that we're here to change.
So the blood transfusion is the only medication or form of treatment.
It's just one of the forms of treatment. Blood transfusion is to restore the hemoglobin. Because when the reversible sickle cells are destroyed by the body, a process
mm,
called hemolysis,
mm,
their hemoglobin drops,
mm.
and it can drop to a dangerous level. So they have to give the blood transfusion. They have to treat
Oh,
the pain. Then they get infection. They get acute chest syndrome, which is the number one cause of mortality in sickle cell.
so if you are watching from Facebook or YouTube and you have any question regarding the treatment of sickle cell, please leave your question in the comment section. I will read it to the doctor and I think you will get your answer. Please, if you are watching right now from Facebook or YouTube, leave your comment, your question, leave it in the comment section. All right. Dr. Sota is about to join again. So meanwhile, if you are watching right now from Facebook or YouTube, please leave your comments, your question in the comment section. Okay, sir.
Okay, you see me now?
Yes.
Okay, I just got disconnected somehow. Okay, so let me go back to sharing my screen.
You don't have to share the screen because you know that it's not appearing, it's going blank. So you can
Okay,
just explain, or you can be reading from there and explain.
okay, that's
Mm,
fine. I can
mm,
read from here.
mm,
So, what is the clinical application of this discovery? Is that oxygen administered in the golden half hour, 30 minutes onset of a crisis,
mm,
restores reversible sickle cells and prevents them from progressing to a critical mass of irreversible sickle cells, wherein the sickle cell crisis becomes established and intractable. So, if we can reverse the low oxygen environment by providing home inhalation oxygen within the first 30 minutes, we can stop the crisis. And when you stop the crisis, you prevent the severe pain, hospitalization, and multi organ damage.
mm,
So, the question is how did we miss this solution in these last 100 years?
mm,
Because by the time patients seek medical care or arrive in the hospital, they are already experiencing irreversible sickling that can no longer be reversed by oxygenation. So the damage is already been done. It's too late.
mm,
So time dependent golden half hour intervention for sickle cell crisis is similar to that of the golden hour for stroke, when the best chance of restoring blood flow and saving brain tissue, or for that of a heart attack from a cardiac infarction, is where timely intervention impacts a patient's survival and quality of life.
Hmm.
And so, in the last 20 years, we have been able to reduce the incidence of sickle cell crisis in our patients, as well as reduce hospitalizations by 90%. So, in one study in the US, 96% of admissions of patients with sickle cell crisis in the hospitals started with a crisis. It's called a vaso-occlusive crisis. That was the 96% of the admissions were from a crisis. So the damage is significant once those cells become irreversible.
So right now, how many hospitals in the United States are using these treatments?
The treatment is not for the hospitals. This treatment is for oxygen in the patient's home.
Yeah, in most cases, the doctors will recommend.
Well, as I advised you before, this is just a new discovery. So
Mm.
we are trying to get this word out for people to change their method of thinking and change the way sickle cell is managed.
Okay, now, given that you are from Nigeria, Edo State to be precise, so how can we distribute these oxygen concentrators to some patients in Edo State? Let's
Well,
start from
I advised you that
that.
in Nigeria, many people may not be able to avoid concentrators.
Mm.
So they have to get oxygen cylinders, which are much cheaper. So, in terms of providing oxygen cylinders, I call on the government, I call on the NGOs, call on the foundations, call on the hospitals, the universities, and the patients to try and purchase this oxygen. Because eventually, for many patients, if they don't spend the $190,000, 90,000 naira, uh, which comes to about $85, they don't spend it on purchasing a cylinder and getting refills for $1 a week. They're going to spend a whole lot more on the hospital care. Within a couple of days of hospitalization, they would have spent all that money. So governments can save money, insurance companies can anywhere in the world will save money by implementing this simple solution, preventing the crisis rather than treating it.
Yeah. First of all, before even uh, talking about distributing the oxygen concentrators to patients, you have to first introduce this treatment method to the doctors, the hospitals, and the medical system in Nigeria as a whole, so that they will start adopting this treatment method. It's a new discovery, but I think you need more introducing it to patients and especially medical doctors.
Well, that's the whole purpose of this, the Zoom, the webinars, the presentations. That's the whole purpose is to introduce it. So we're trying to change the whole paradigm. So we've just started. So we expect other doctors who have been privy to learn about this from here to also spread the word. But it's been going this paradigm has been going on for 7,300 years. So we're just starting it now.
So, how long have you been introducing this treatment method to patients? Is this
Well,
something? Is this something of recent, or you have been doing for the past 20 years, 30 years?
no, it's just of recent that we've exposed this to the public. We've just been doing this practice in our clinic, but it's just of recent this year that we started trying to publicize this discovery. But let me go on with my presentation. I've not finished it. So, the aggravating factors of a sickle cell crisis. is a low oxygen environment, especially when there are one or more triggers, such as increased anemia, stress, exertion, exhaustion, infection, increased sedation, alcohol ingestion, altitude, cold environments, infection, or any feeling of being unwell. And that's when patients need to sleep with oxygen or apply oxygen. Now, the most risky time for a sickle cell crisis is when the patient is asleep, because we have a phenomenon called nocturnal hypoventilation, which is a big medical term for shallow breathing. So when everybody sleeps, their breathing is more shallow, but sickle cell patients are more sensitive to the drop in oxygen from the shallow breathing. And that's why most patients wake up from sleep with a crisis. This crisis can be completely prevented by sleeping with oxygen, especially when these triggers are there. But in the absence of triggers, they don't have to sleep with oxygen. And most importantly, if they wake up in a crisis, they should immediately turn on their oxygen cylinder or concentrator and apply oxygen within the golden half hour to stop the crisis. So let's look at some of the medications that have been out there for a while. One of them is hydroxyurea. And what does hydroxyurea do? Hydroxyurea increases the production of hemoglobin F. And what does hemoglobin F do? Hemoglobin F is a hemoglobin produced by the fetus in the mother's womb. And nature provided hemoglobin F to potentiate the transfer of oxygen from the mother's blood to the fetal tissues, a goal achieved by the higher oxygen affinity of hemoglobin F compared with hemoglobin A. So it's when hemoglobin F begins to drop off after birth that you have the issues of sickling in infants with sickle cell crisis. And so, again, we're talking about oxygen. Hemoglobin F tried to increase the oxygen affinity because nature knew that the sickle hemoglobin requires oxygen to prevent sickling. And that's why the drug hydroxyurea has had some modest success in treating sickle cell. But it does not prevent a crisis. There's only one method that prevents and treats and stops a crisis. And it's not a medication, it's a gas, it's oxygen. So one of the last things I want to highlight is air travel. Air travel is a hidden danger for sickle cell patients. During and following commercial airline flights, patients with sickle cell have been known to experience complications, bone pain, spleen infarction, avascular necrosis of the hips, prolonged crisis resulting in death, and in a few cases, the patients have died in the aircraft. And these complications have been linked to prolonged oxygen desaturation at high altitudes, with oxygen saturations measured as low as 77% instead of the normal of 95 to 100%. So it's important, especially for the President Tinubu and the Minister of Aviation, to compel airlines coming into Nigeria, in or out, to provide compressed medical oxygen for patients. Especially the airlines from the United States. The European airlines do provide compressed medical oxygen on request. It only costs $20. And there's absolutely no reason why airlines from the United States cannot provide oxygen. In fact, recently there was a patient from the Sickle Cell Forum who traveled from Nigeria to Dallas and called me after she arrived here saying she was not feeling well. Within a few hours, I advised her to go straight to the hospital. She ended up with a drop in hemoglobin to hemoglobin of hematocrit of 18, requiring multiple blood transfusion, requiring IV pain medicines, IV antibiotics, experiencing severe pain and suffering, having to undergo CT scans of the chest, the abdomen. Essentially, almost care of about $50,000 because the United States airline, Delta Airlines, couldn't provide a $20 compressed medical oxygen for her. So this is a travesty. Nigeria, as a country with the highest population of sickle cell patients in Africa, cannot allow these airlines of the United States to mistreat our citizens, to assault them, and to kill them, essentially, by requiring them to have oxygen concentrators. That the oxygen concentrators for flight that are approved for flight are much, much more expensive. Together with their batteries, they can cost $3,000 to $5,000. That's not an alternative to a $20 compressed medical oxygen. So let me go in terms of the treatment of a crisis. If the crisis cannot be aborted within 30 minutes, then something else is going on. Either infection, severe cold, or a sequestration crisis. So the patient needs to get medical attention immediately. And time is of essence because pain itself worsens a crisis. Severe pain produces chest splinting, inadequate respiration, decreased oxygen, and additional sickling. So my recommendation is that a patient's physician or hospital should have a standing order for an emergency medical service ambulance team or a home health nurse to administer at home the first dose of an opioid and anti-inflammatory injection that the patient has previously tolerated.
Yes, sir. I have a quick question before we end this program because it's almost 1 hour now.
Okay.
So, are you planning to work with some medical doctors in Nigeria to introduce this method of treatments to them so that they will also recommend for their patients?
Yes. I'm conducting webinars and Zoom conferences with Nigerian doctors. Some of them have already started implementing this paradigm, prescribing oxygen for their patients at home. And we've had numerous testimonials from patients in Nigeria who have obtained this oxygen and who have already begun to experience a significant difference in their lives. I don't know, Dr. Ms. Obasugi, if you can put up any of those testimonials from patients in Nigeria, apart from the patient on the video. Because we've had several who are testifying to this oxygen. The effect, the transformation is immediate. It's immediate. And so, but we continue to be ready to share this knowledge. We're going to be ready to present this information at any webinars or Zoom conferences. And so, yes. So, we have... Okay. There's a question here. What's the difference between compressed air and pressurized air? No, we're talking about compressed medical oxygen in oxygen cylinders. The oxygen you have in a cylinder is a compressed medical oxygen. It's not compressed air. But aircraft are pressurized to 8,000 feet, which means that when the aircraft is at 30,000 to 40,000 feet, I mean, that's almost like Mount Everest. Nobody would be able to breathe. There would be very little oxygen in the air. So aircraft are pressurized to 8,000 feet, which most people can tolerate. But patients with sickle cell, and a few patients with sickle cell trait, may have problems at 8,000 feet. Sickle cell patients will have problems at 8,000 feet. Their oxygen saturation will drop significantly. And you can imagine spending 6, 8, 10, 12, 16 hours traveling at 82% oxygen saturation. That essentially is multi-organ damage. That can be simply prevented by breathing oxygen from a cylinder. I know British Airways provides compressed medical oxygen. Air France provides compressed medical oxygen. Only the airlines from the United States, Delta, United, American.
What about the oxygen concentrator? They can use it inside the flight.
Only a few concentrators are approved for the flight,
Okay.
and those concentrators are very expensive. They are three
Mm,
to
mm,
$5,000,
mm.
and sometimes they can fail during flight because they are a mechanical device, or they can fail at a destination, or they can be dropped. Now, if the oxygen concentrator fails at 40,000 feet, there's then you must get the compressed oxygen from the airline.
I think we have to end this program for today. Next time we'll come back again, and I want to see us bringing more doctors from Nigeria joining this program.
That
So,
would be
because yeah, the more we do that, the more we introduce this treatment method to many physicians or doctors in Nigeria that will help, to mitigate the symptoms of sickle cell, right? It will not totally cure the sickle cell, right? But it will mitigate the symptoms. Am I right, sir?
it will stop the crisis.
The crisis.
And the crisis is responsible for all the
The
complications.
patients. Okay.
So when you stop the crisis, you stop the complications. Patients can live their lives and it can be managed just the way like diabetes was managed with the
Managed.
discovery of insulin.
Fantastic. Well done, sir. Well done for this discovery. How many years have you been working on this research before you finally discovered the treatment?
We've been working on it for 20 years. We've been using oxygen for our patients to prevent crisis, but we're trying to elucidate the full scientific explanation for why oxygen was working and the time period in which it works. I mean, oxygen is already standard of care everywhere in every hospital everywhere. What
Exactly.
was different was the explanation of reversible moving to irreversible and the timing of the oxygen. It is
Mm,
the timing that makes a difference
mm,
between a patient with a good lifestyle and a patient in hospital, patient dying from sickle cell from.
mm. Yeah, managing it properly. Yes.
Yes. Not,
Thank.
and actually, the key is prevention. The paradigm going forward is prevention of a crisis instead of treatment of a crisis.
Of crisis. Yeah. Prevent. Prevention is better than cure.
Exactly.
Right? So
Yes.
yes. So I look forward to bringing you back to this program. But before we do so, I'm planning to contact some medical doctors in Nigeria and bring them to this program. You
Very
understand?
good.
So that we want to hear from them, their method of treatment over these years in Nigeria. Then you can also introduce your treatment method in the United States to them. So that is what we want to do in this program next time. Thank you all for watching. For those who are watching from Facebook and YouTube, thank you all. Stay tuned for our next program. Thank you, sir, and thank you for your research. I know that you have been working over these years. And finally, the discovery is very productive and effective right now. We have many testimonies. Next time, if we come back, I will read the testimonies from Nigeria for those who have been using this method of treatment. So stay tuned for our next program. Thank you, sir.
You're
Thank you.
welcome. Thank you.
Yeah, bye.